All right, today we're going to crack open a medical case that's been sealed for, well, over 1,000 years. And what's inside? It's not dusty old relics, I'll tell you that. It's a surgical toolkit so incredibly advanced, it's going to challenge everything you thought you knew about ancient medicine. We're diving deep into the Ashtanga Hridya, an ancient Ayurvedic text that, believe it or not, lays out a blueprint for surgery that feels, well, surprisingly modern.
So, be honest, when you picture ancient surgery, what comes to mind? Something kind of brutal, right? Maybe a bit clumsy. Well, what if I told you that more than 1,000 years ago, surgeons were working from a really detailed blueprint? I'm talking a set of design principles for their tools that didn't just prioritize function, but also the patient's actual experience.
Okay, so before we even get to the cool stuff, the tools themselves, we really have to understand the philosophy behind them. You see, this wasn't just about hammering out some sharp objects. No, it was about a set of incredibly rigorous design principles. Think of it like a checklist that every single instrument had to pass before it was allowed anywhere near a patient. And this single line of Sanskrit, this is the blueprint. It's kind of like the ancient version of an ISO certification for medical devices, if you can believe it. This one line is a complete checklist for how to make the perfect surgical tool. And man, it tells us so much about how they thought about medicine. So let's break down what this verse is actually saying. Okay, good grip, makes sense, very sharp, yep, you want that. Well finished, of course. But then you get to this one, not frightening. I mean, just stop and think about that for a second. The design of the tool had to actually consider the patient's psychological state. It wasn't just about being effective, it was about empathy. The tool itself had to be designed to make people less scared. That's just incredible. All right, so with that amazing design philosophy in mind, let's actually see what these instruments looked like. Come on, let's step into the ancient operating room.
And wow, what a collection it was. I mean, chapter 26 of this text, it describes 26 distinct types of sharp surgical instruments. So we're not talking about just a simple knife and saw here. This is a highly specialized toolkit with a specific instrument for pretty much every surgical need you could possibly imagine.
Okay, first up, let's look at the Vriddipata. Now, the easiest way to think about this is like the great-great-great-grandfather of the modern scalpel. It was a razor-sharp tool, basically the workhorse for the ancient surgeon, and it was designed for super precise work on soft tissues.
And its job? Well, it was pretty much exactly what you'd expect from a scalpel, making clean, precise cuts. The text even specifies that it was used for both incision, cutting, and for scraping, which made it a really versatile tool for opening things up and cleaning out surgical sites.
All right, so we've covered soft tissue. Now let's move on to something much, much harder. This here is the Karapatra, the bone saw. Yeah, a pretty formidable instrument for a pretty formidable task.
And just the fact that a dedicated bone saw even existed tells us something really profound about what these surgeons could do. They were performing complex orthopedic procedures, things like amputations, that required sawing through solid bone. I mean, this is a level of surgical intervention that a lot of us just assume is a modern invention.
Okay, now for a design that is just truly ingenious. This is the mudrika, or the finger ring knife. It's a small, precise little blade mounted on a ring, and the surgeon would wear it on their index finger. Just try to imagine the level of control that gives you.
So you're probably asking, why would you want a knife on your fingertip? Well, for incredibly delicate and hard-to-reach places. Think about working inside the throat, where a traditional handle would be super clumsy and just block your view. This is taking surgical precision to a whole other level.
And here is a fantastic example of ancient biomimicry, looking to nature for design inspiration. This is the Sharara Mukha. Its name literally means face of a Sharari bird. These ancient designers were looking at the world around them, and they recognized that animal beaks were perfectly evolved for specific tasks, like gripping and piercing.
So what was this bird beak tool actually used for? Venesection, or bloodletting, specifically on the very delicate veins of the face. That shape was perfectly designed to puncture these tiny vessels with incredible precision and without causing a lot of unnecessary damage. See? Again, it's all about having the right tool for a very specific job.
So if you put these two side by side, the Vriddipatra for soft tissue and the Karapatra for bone, it just perfectly illustrates the core principle we've been talking about, specialized design. There was a specific, totally optimized tool for every single job, from a simple little cut all the way to sawing clean through a bone.
But wait,
The procedure didn't just end when the final cut was made. Not at all. This text reveals a completely holistic approach to surgery, and that includes a really detailed protocol for post-op care. See, the healing process was considered just as important as the operation itself.
Let's go back to that venous section we just saw. After the procedure was done, a cooling paste would be applied to help with pain and swelling. And then, the area would be bathed in warm ghee. This just goes to show you, the focus wasn't just on the surgical act itself, but on actively managing and promoting the healing afterward. So, as we start to wrap up our little tour of this ancient toolkit, it's pretty clear we're not just looking at old, rusty tools. We're looking at a legacy of sophisticated medical knowledge, a system that was just far more advanced than I think many of us could have ever imagined.
You know, from the sharpness of the blades to their deliberately unfrightening shapes, from all the specialized tools to the detailed aftercare, what we see is a picture of a system that was deeply focused on precision, on function, and on the holistic well-being of the patient.
And here's the thought I really want to leave you with. Remember, this isn't a system from 50 years ago. This is from over 1,000 years ago. The intricacy, the compassion, you can literally see embedded in the design of the tools. It all points to a much bigger question. What does this ancient knowledge really reveal about our timeless and deeply human pursuit of healing?